Are you using Tadalafil, but not getting the results you hoped for? You're not alone. Many men take this powerful ED medication without realizing that a few simple mistakes can dramatically reduce its effect. In this video, I'll reveal 5 science-backed tips to help you maximize Tadalafil in the treatment of erectile dysfunction, improve your confidence, and bring the spark back to your intimate life. Before we dive in, make sure to subscribe, like, and share this video, because this is information every man should know. Erectile dysfunction is a very common condition in modern society. It's estimated that about 10% of men under 40 will encounter this issue at some point in their lives. Meanwhile, approximately 30 to 50% of men aged 40 to 70 will be diagnosed with erectile dysfunction during their lifetime. The primary form of treatment involves using 5-phosphodiesterase inhibitors, such as Tadalafil and Sildenafil. These are vasodilators, medications that work by boosting blood flow to the penis, enhancing firmness and rigidity needed for sexual activity. It is fairly common for patients to report that Tadalafil isn't as effective as it once was, or that it has stopped working entirely. In many cases, this is due to incorrect use, or because some adjustments in how the medication is taken are necessary. In this video, I'll share 5 valuable tips you can apply to improve the effectiveness of this medication. Our focus here will primarily be on on-demand use, meaning taking the medication specifically on the day you plan to engage in sexual activity. The first tip is to ensure you are purchasing high-quality medication. One frequent question people ask is whether generic medications and brand-name drugs deliver the same results. It's important to understand that quality can vary between products. If you trust the generic manufacturer and have used their product with good results before, it's usually fine to continue with it. However, when using medications that need to deliver fast and noticeable effects, it's crucial to use trusted, high-quality options. For example, many urologists recommend Cialis or Cialis to patients, not because of industry ties, but because these are known to be dependable choices. Tadalafil is available in 2 dosage strengths, 5 milligrams and 20 milligrams. The 20 milligram dose is meant for use on the day of sexual activity. It produces a stronger effect, and you can remain active in your bloodstream for up to 36 hours, depending on both the medication's quality and how well your body absorbs it. Tip number 2. Try taking the medication on an empty stomach. Many patients mistakenly associate taking Tadalafil with drinking alcohol or consuming heavy, fatty meals. Both alcohol and large meals can interfere with the medication's absorption in your gastrointestinal tract. This can noticeably reduce how effective the medication is. If you've noticed the drug no longer seems to work as well, it may help to take it on an empty stomach and avoid alcohol or rich meals before use. If you're still watching this video and finding these insights helpful, and you haven't subscribed yet, I recommend clicking that button and turning on the bell so you don't miss any future videos. Your support helps us continue creating content to inform and inspire you. The third tip is to actively seek sexual stimulation while taking the medication. We always remind patients that it's not just about swallowing a pill an hour beforehand. You can't take the medication and then go to bed, read a book, or watch a football match. To trigger an erection, stimulation must occur. This entire process begins in the brain. It's a neurological response. Therefore, patients must engage in some form of sensory stimulation through touch, scent, physical contact, or whatever works best for them. The key point is this: after taking the medication, you need to actively seek arousing stimulation. Now, for the fourth tip, using the correct dosage of the medication. When discussing 5-phosphodiesterase inhibitors, we typically refer to Tadalafil and Sildenafil. The 20 mg dose of Tadalafil is designed for on-demand use prior to sexual activity. Some patients mistakenly believe that 5 mg will provide the same results. It won't. The 5 mg dose is intended for daily use as part of a treatment plan, regardless of planned sexual activity. So for the strongest on-demand effect, 20 mg of Tadalafil is the preferred choice. Similarly, Sildenafil, commonly known as the little blue pill or Viagra, is available in 25 mg, 50 mg and 100 mg strengths. Each patient must find the dose that suits their individual response and goals to achieve the desired outcome. The fifth and final tip is about timing. When to take the medication relative to sexual activity. Many patients typically use the medication 30 to 60 minutes beforehand. However, one useful suggestion is to try taking it 1 to 2 hours prior to activity. As mentioned earlier, Tadalafil's effects can last up to 36 hours, but its peak impact occurs within the first 10 hours after ingestion. Therefore, for optimal results, aim to take it at least 2 hours in advance and try to engage in sexual activity during that peak window. After about 10 hours, the medication starts to clear more rapidly from your system. If this video helped you in any way, consider giving it a like, subscribing to the channel, and hitting the notification bell so you don't miss future content. And if you feel comfortable, share your thoughts or experiences in the comments below. We read them all, and you never know who you might help just by speaking up. Thank you, and see you in the next video.